All right, well, you're still asking us questions and we're still trying to provide answers on this special update of the vaccine and the coronavirus. And we are so happy. This is our quarterly update with Dr. Fisher, so stay tuned for more. Hey everyone, and welcome to Scan FYI. And we have an update for you today, a special edition, right, Mary Beth?
Special edition, yes, we do. So good morning, Dr. Fisher. How are you today?
Good morning. I am excellent. Thank you.
Good. So Dr. Fisher is the Medical Director of Clinical and Academic Excellence at Monmouth Medical Center. I'm going to make sure I got that in this morning. So, and your other role these days is, tell us again what that role is with the state.
So I'm a special advisor to the Commissioner of Health.
That's all. You're not too busy. So first of all, we are so appreciative of having you back. I remember the last time you were with us and you said, ask me back in June and let's see how we're doing. So it's June. And so how are we doing?
Well, I am delighted to tell you that we are doing beautifully. So the incidence of disease in New Jersey is definitely on the decline. The number of hospitalizations have dropped dramatically and the number of deaths have really dropped. So we are finally out of the top 10 in the nation as far as hospitalizations. And
oh, well, we have to toast to that.
Way down.
One time you don't want to be in the top 10.
Exactly
hey.
Right.
Good job, New Jersey.
Yeah. But even though we're still in it though, we're not, I don't want people to hear that and say, well, okay then, see, I told you so.
All right, you and me both. So we know that the virus hasn't gone away yet. And we know that as long as there's virus and that it's infecting people, it has the opportunity to mutate and come up with these variant viruses. And we're very concerned about the variant viruses. We're concerned because it's possible that one of the variants will emerge as a major cause of illness, either in a different age group, for instance, in younger people, or it's possible that it will not be the same immunologically, so that people who were already affected or people who were already infected or people who were immunized might not be protected against a new variant. So we have to keep that in the back of our minds, and we have to be thoughtful, and we have to really remember that we're not quite out of this yet. To get out of this, we really want every single person to be immunized. So everyone who's eligible, we want them to be immunized. And right now that's everyone 12 years of age and older.
So what do you want to say to those people out there that are still showing some resistance to either getting the vaccine at all, or they had vaccine number one and just never got around to finishing it off?
So I want to tell them, for the second people, I want to tell them, thank you for getting that first dose, but you can really improve your protection by getting that second dose. So with 2 doses of the Moderna and the Pfizer vaccine, your protection goes up to about 94, 95%. So that's what we want. We want, don't want you to be at 60 to 80%. We would like you to be truly protected so that you're not going to get a breakthrough case of disease or get sick from the virus. And of course, we don't want you to spread it to your loved ones.
Yeah, that's, for me, that's the biggest one of all. I feel like I want to be part of the solution, not the problem.
Exactly.
So I was going to ask, again, looking ahead to fall a little bit, where do you think we're going to be with the school children?
Yeah.
So there's good news here as well. So the Pfizer and Moderna are both testing their vaccine in younger and younger ages. Pfizer feels that they will probably have enough evidence for children down to 5 by September, and children down to 6 months, maybe by the beginning of next year. So if we could get those children down to 5, that would really take care of the school-age children. And I think that would make all of us a little bit more comfortable with everything. So we know that spread in school really has not been a major problem, particularly where unvaccinated children are wearing masks and keeping that 6 feet distance. So until people get vaccinated, the American Academy of Pediatrics is still recommending that in a school setting, in an indoor setting, indoors, that unvaccinated people should still be wearing masks. When you're outside, that's a different story. So once you hit the playground, yeah, you can take off your mask, you can keep it for later. But when you're inside, particularly when you can't really maintain that 6 feet very well, please keep the masks on. We want to protect as many people as possible.
So what I'm kind of getting from this, Dr. Fisher, is for indoors, even vaccinated, we still need to have some social distancing. This is still a factor for indoors?
So indoors, if you're vaccinated, that's a different story. So indoors and vaccinated, unless you're in a very large crowd, you can forego the mask. Now, there are exceptions. So you still need to wear a mask when you go to a healthcare center. That's still the rule in New Jersey. And I suspect it will be the rule for at least the foreseeable future. But if you're indoor with your family, friends, go ahead and you're immunized, go ahead and take off those masks.
What about concerts and all of the things that we like to do at the Jersey Shore in the summer? Indoor, outdoor concerts, going to the movies even. What's your thoughts about that?
So again, it depends on the density of people. So if you're indoors and you know everyone there is vaccinated because they have to be vaccinated to get a ticket, you are good to go. On the other hand, if you're indoors, there's hundreds of people, you're, neck and neck, and nobody's really checked whether people are immunized or not, I'd be careful in that scenario, and I would consider wearing a mask. And then remember, for concerts are very loud, so protect your ears as well. We're finding more and more that teenagers are going to have hearing loss because of either earphones or concerts and not protecting their hearing.
We heard that from our audiologist, Dr.
Yes, Dr. Gavin, a recent guest, noting that in the younger generation, more hearing loss than ever before. So that's a whole other thing, though.
Correct.
That's another thing.
And unrelated to COVID.
Yeah, unrelated to COVID, but not good. Definitely not good.
Not good.
Well, the mask situation seems still very divisive. And everything seems divisive lately. But something that you just said about if somebody asks you if you go to an event, you need to be vaccinated to buy a ticket or something like that. Do you feel like is that happening? Is that part of the culture now that we're going to be asked if we were vaccinated?
I think it depends on the venue and the event. But yes, I think that is happening more and more. And I actually don't have any problem with it. I think the only concern we have is we know that in New Jersey, the vaccine uptake has unfortunately not been equal across the different races. So we know that we haven't been able to get vaccine to as many Hispanics and to as many Blacks, African Americans. So I don't want to punish people who haven't been able to get the vaccine. Right. But what I really want to do is push them and tell them, please protect yourself. It's, now is not the time to let down your guard. Now is the time to do everything you can to ensure that you're going to be protected. And the best protection is getting that immunization.
Now, Dr. Fisher, does the state of New Jersey have any mobile units going into some of the communities that might not have access?
So we have a bunch of different mobile units. So a lot of the health departments and some of the like Visiting Nurses Association and some of the hospitals have their own mobile units, and they've been using them for months. The Department of Health has 3 mobile command centers. I mean, these are not little vans; these are huge, and they are a little unwieldy. And we are actually just getting them launched. So they are planned to officially launch. They've been here and there for the last month, but they are officially going to be launched on Friday. And we're hoping there will be one for the North, one for the Central, and one for South Jersey. And they would go into areas and provide vaccine and testing.
Okay, great.
Well, there's so many people. It's not that are challenged as far as transportation and logistically. So I'm glad to hear that New Jersey is working on that. And it's good to be in a state that's moving in a positive direction.
Yeah, the one statistic that's incredible is in New Jersey, there is a vaccination site within 5 miles of every resident in New Jersey. So if you can get from your house 5 mile distance, then you can get to a vaccine site. Of course, some of the issues are that not everybody can walk 5 miles. So for areas where there are a high percentage of people who don't have transportation, we're trying to ensure that there's a site within a 15-minute walk. So we're really doing everything possible to make more and more centers available. And the other thing we're doing much more now is trying to get the vaccines into your primary care physicians, so that you can go to your own doctor and get the vaccine there. This will be especially important with pediatricians and as we start to immunize children.
Dr. Fisher, how do you feel now for summer for travel? I mean, travel out of state.
So again, good news. Even the Centers for Disease Control and Prevention is loosening up on their travel recommendations. And I think that as we see more and more people immunized, again, if you are fully immunized, you're good to travel. Now, I'm not sure I would go internationally to an area that's a hotspot. I mean, I think that's just, maybe pushing your luck. But for most places, even international, you are good to go if you are fully vaccinated.
Okay. Would you have any hesitation about getting on an airplane or a cruise ship?
So the airplane, the answer for that is the airplane is actually not the problem, because on airplanes, people are required to wear masks.
Yes, that's right. That's right.
And the airflow is actually excellent as far as reprocessing of the air and making sure that it's no longer recirculated. So the airplane is fine. It's the airport where you just need to be a little bit careful, again, because you get large groups of people and you don't know who's immunized, who isn't immunized, and there are other things besides COVID that you can pick up in airports. I think all of us can probably remember back to the days when we were traveling more, and within a few days of getting home from one of those trips, you came down with some viral illness.
Yeah. Now, what about a cruise ship? Do you have any thoughts about that?
So I think the cruise lines are all beginning to open up again. Personally, I think cruises are a wonderful way to really get away, relax, and have a great vacation. For most of the cruise lines, they are requiring that you're immunized or that you test negative before you can get on board. Okay. And they're doing the same for all of their staff. So with those caveats, I think you're good to go. And in fact, at least right at the beginning, as soon as the things open up, that's going to be kind of the ideal time, because the cruise companies are going to go overboard to be sure that you're protected.
Yeah, which is a good thing.
It's a wonderful thing.
Yeah.
Well, I sense a lot of positive energy coming from Dr. Fisher.
I think that's true most of the time, but now,
absolutely. Exactly. Yes. Yeah.
Well, this is really, I think, great news for the state of New Jersey, that we can feel pretty good about the summer and get out and enjoy and do most everything that we want to do, still being cautious, and I guess still social distancing as necessary. And of course, there is no substitute for common sense.
Which is very uncommon.
Yes. Why is that's another show, though. That's a whole other story. But yeah, I feel like using common sense, you can have a great summer at the Jersey Shore. and everywhere else in our listening area, right?
Absolutely. And one thing I would encourage you all to do, everyone who's been immunized, please tell your story to other people. Please ask the people that you run into, have you been vaccinated? We're having work done on our house, and our electrician was very hesitant to get vaccinated. But every time he came to our house, he got asked the same question over and over and over again. And today he told me his appointment is for next week.
All right. All
So,
right.
you know,
Positive influence.
I think that we, your peers, are peer pressure works, particularly for teenagers and younger people. So really tell those stories about the fact that, at least for most of us, once we got our vaccine, we really felt liberated and, ready to get back,
That's a
back
good
to
way
the
to put
life
it.
that we were missing.
Yeah. Yeah. I felt a sense of freedom that I would feel good about resuming. But for me, it really was about, I wanted to be part of the solution. That was just my very personal feeling.
Great.
And I'd like to see more people feel that way. So very good. Excellent news today. Well,
Yeah.
we're going to look forward to seeing you in a few more months and kind of the end of the summer and, getting ready for fall, like Mary Beth was asking about school. And we're all anxiously waiting to see what happens and hoping that the kids are all back in school. And of course, even at SCAN, our adult kids are back. So we shall see what happens, right?
Terrific.
All right, Dr. Fisher, always a pleasure to have you as our guest. Thank
And
you.
a pleasure for me to be here with you.
All right. Remember, everyone, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on SCAN FYI. Bye, everyone.
Bye. Have a great day, everyone.